Hey everybody, Dr. Ashley here from Feldman Physical Therapy and Performance. Thanks for tuning in. Today I wanted to talk a little bit about returning to running for all of the new moms out there. It's a question I get often in the clinic, and it's something that I feel like the education needs to be put out there so that women don't hurt themselves when they want to get back to running after having a baby. So do me a favor, make sure that you stay tuned to the end because I am going to give you self-tests that you can do to make sure that your body is ready to get back and hit the ground running. So as always, we are so grateful that you're here. If you haven't already, make sure you hit the subscribe button below. And if you're enjoying our content, share it with your friends. We're always looking to give you guys the latest and greatest information. And if you haven't noticed, we like shoes too. So stay tuned for more of our shoe reviews. So the big thing is that returning to running after having a baby isn't so clear cut. A question I often get is, hey, my doctor told me that I can get back to activity after 6 weeks. However, when I run, I pee my pants. I feel pressure. I feel something hurt in my abdomen, and it's just not okay. It doesn't feel okay. And that's because, believe it or not, running sometimes happens too early. Unfortunately, there's so much misinformation out there, and the guidelines for return to activity vary not only amongst practitioners, but it varies from country to country. These guidelines are so variable. And that's a tough part about instructing an individual about returning to exercise. So guys, let's dive a little bit deeper and talk a little bit about some of the signs that you may see that mean that you may not be ready to get back to running, especially if you've been given that green flag at your 6-week mark. Luckily for us, in 2019, 3 physios out of the UK put out guidelines about women returning to running postpartum. It's awesome. It gives us as practitioners new information, but it's also solidified old things that we've known for a really long time, such as 6 weeks is probably a little bit too early for females to return to running after having a baby. So believe it or not, the recommended time frame for women returning to run, 12 weeks postpartum. And for some women, it may be upwards of 6 months. So that's a really wide range of time. And why is that? I always say you have to remember everybody's birthing story is different. Some women deliver via C-section and some women deliver vaginally. Both norms in today's society as to how to deliver a baby. However, you have to remember there are sometimes things that are associated with those two. With a C-section, you have surgery. With a vaginal birth, you may have things such as tearing that occur, and those things take time to heal. The other thing is that when you do get back to high impact activity, this goes right along with our guidelines about the 12-week mark, we can increase the pressure in our abdominal area, which then increases the pressure on the pelvic floor. If you've given birth recently, think about the things that I just said. Pressure on the abdomen, pressure on the pelvic floor. Those are 2 areas that, say you have had a C-section or you've had a tear or even just a vaginal birth, those areas need time to heal, which are so important to longevity and also getting back to running without problems. So I know I said I was going to talk a little bit about the symptoms that you see that should say to you, oop, red flag, I shouldn't necessarily be getting back to running yet. And there are things that are so common amongst women who have just recently had a baby. What are some things that you can think of? I'll leave you there for a second. And when I come back, I'm going to go ahead and go over the list a little bit more in depth. What are some things that you thought of? I'm sure you thought about peeing while laughing and maybe some pressure in the vagina area. What about this whole thing, this abdominal separation that happens often? And the last one, pain. Pain in the hips, pain in the pelvic girdle, pain in the low back, all common things that we hear newer moms say after childbirth. The thing I want you guys to know though, these aren't normal and they shouldn't continue for prolonged periods after giving birth. The whole peeing is gonna last forever when I laugh or sneeze or cough, not so true. And the same thing goes for running. You should not be peeing while running. And if you are having these, this is actually a little bit of a red flag as to getting back and hitting the ground running. The same things go for any type of musculoskeletal pain, so pelvic girdle, low back, as I said, hips, even knees, upper back, you might want to look at that and address it a little bit first before you think about getting back to running. If you're feeling heaviness or bulging, say in the vaginal area, then that's also something that should say, oop, I need to get this checked out by a physician before I decide to go do heavy impact activity. And the last but not least, what I was talking about, that abdominal separation, diastasis recti, diastasis recti, however your provider says it, it's something that happens in almost 100% of births, or 100% of pregnancies, sorry, not births. But it shouldn't necessarily last for prolonged periods after you have given birth. For some women it does, and for some women it can be functional and they can work through it. However, this is also something when you have to think about that as you run, pressure increases in your abdomen, because believe it or not, a DRA can get better with time. So ladies, these are all things that you need to be on the lookout for around that 12-week mark, or say that 6-month mark, wherever you are, that tell you, ooh, maybe I shouldn't start running yet or doing high impact activities. Of course, I will recommend an evaluation by a physical therapist before you get back to doing activity after pregnancy. The reason being, a lot of us are well versed in movement patterns and what you really need to be doing before you get back to running. I will note that you should find someone who has some knowledge about running postnatally or postpartum, whatever you want to call it. And also, if you really do need a little bit more of an evaluation of your pelvic floor, if you're having that incontinence, if you're dealing with that pressure and heaviness, or say even pain with sex, there are such things as pelvic floor physical therapists who can help you in that area. But what I want to do now is get you into performing these self-testing ideas and strategies to see whether you really are prepared to get back to running. And I will note that during these tests, you should experience no heaviness, no incontinence, no dragging, no real kind of flaring of your diastasis recti, as well as minimal musculoskeletal pain. So here we go, ladies. Now, a lot of the tests that I am going to provide you are functional and relate directly towards running. However, interspersed are some strength test protocols that I like to put in place with all of my runners to decrease the risk of running-related injury over time. So as I go through these tests, I will note whether they are more for the function of running or whether they are the strength behind the idea that we can decrease your risk for injury over time. Test number 1 is being able to walk for 30 to 45 minutes at a brisk pace. Test number 2 is being able to balance on one leg for 20 to 30 seconds. Test number 3 is being able to perform a double leg squat for 10 repetitions. Test number 4 is being able to perform a single leg step down or a single leg squat for 10 to 15 repetitions on each side. Test number 5 is performing a double leg small hop for 1 minute. Test number 6 is performing a single leg hop in place for 30 seconds on each side. Test number 7 is being able to perform forward bounds for 10 repetitions without any of the symptoms I've spoken about. Some extra strength tests I like to add in are the performance of single leg calf raises for 25 on each side, single leg bridges for a 30-second hold on each side, and a side plank with hip abduction for 45 seconds. This can be modified to doing a modified side plank with your knee on the ground with your leg abducted for the same amount of time. If you're a new mom looking to get back into running, I sure do hope that you learned something today. Remember, for some individuals, it may take 12 weeks. For some, it might take 6 months. Remember, take your time and take it slowly. Allow yourself time to heal. Allow yourself time to adjust, and do not rush your recovery. So the big thing is that I know that a lot of women have fears and hesitations about getting back into physical fitness after birth. So what I want you to do, write them below in the comments section and let's start a little bit of a chat about this. Let's get women to talk. Let's face those kind of things that we all say, oh my goodness, what's preventing us from getting back into fitness after we've given birth? So the other thing is, if you have any questions about the content in today's video, also don't hesitate to post them below. We'll be sure to get back to you as soon as we can. So as always, ladies and gents, we love giving you the latest and greatest content. However, for now, happy running.